Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? Hey, this is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. And folks, I'm your host. Every single week, me and my company, Christian Brindle Insurance Services, bring you a podcast where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. This is episode 258, folks, and we are literally probably about a week away from the start of the Medicare annual election period, although it might seem like we're in it already due to all the advertisements and propaganda and just the overall flood of information you've probably been getting through TV commercials, social media ads, phone calls, things in the mail. Your mailboxes are probably about to explode due to all the mail that you are getting right now. I wanted to explain a couple of things on this episode here today, and I'm really excited because we're planning to bring you an episode each and every week all throughout open enrollment. So I think that a lot of you are in for a treat if you just make sure that you tune in every single Monday. And folks, on this episode, the few things that I actually want to share with you, in my opinion, are going to be very helpful. The first one is some mistakes that people make that end up causing them to be in bad Medicare Advantage plans. I think Medicare Advantage, for the most part, gets a bad rap. I don't see it as much these days. I think a lot of the myths and a lot of the bias has really been put to bed. I think those people that really kind of created that narrative have really been buried and just kind of forgotten about because their takes just have been proven false and not true. Medicare Advantage enrollment has grown dramatically over the last few years. And there's a reason for that. It's because the Medicare Advantage program continues to expand, right? It continues to just keep growing. But still, from time to time, you talk to somebody that they're like, I enrolled into a Medicare Advantage plan, and it's the worst thing I ever did. Well, let's dissect that. Why is that? I'm going to give you a few scenarios that every single person that's ever enrolled into a Medicare Advantage plan and had a bad experience, this is it. Everything. You can put them all in a category, and I'll cover them on this episode before we're done. And this is how you can avoid it. It doesn't mean Medicare Advantage is a bad thing. Number one, well, before I actually get into those, I need to go through a little bit of an explanation of what makes up a Medicare Advantage plan. So what does make up a Medicare Advantage plan? Well, simply put, a Medicare Advantage plan is going to have a lot of different working parts, right? So a Medicare Advantage plan is essentially a plan that you run your Medicare through, right? You get Medicare Part A, Part B through the government. You run your Medicare through that Medicare Advantage plan. And more or less, that Advantage company takes the place of your Medicare, right? Takes a large burden off of Medicare's shoulders. They agree to federally fund that Advantage plan every month to take care of you. That's how they offer you $0 premium plans. Right? I think we all know that this far into the show. We've talked about that enough on this show. And so there's a lot of different variables in play, right? There's a lot of different working parts that make up a Medicare Advantage plan. You're going to have networks of hospitals and doctors, and those networks are going to vary tremendously from one company to another. You might have some companies that have huge, great big networks that give you all kinds of choices in your area. And then you might have itsy-bitsy tiny networks that just give you very limited choices, and it restricts you tremendously. You also have prescription coverage plans. Part D plans are built into it, right? You have drug coverage included. An Advantage plan is going to give you medical, prescription coverage, dental, vision, hearing, all wrapped together into one plan. 99 out of 100 Medicare commercials are selling Medicare Advantage. And so what you find with this is typically when somebody enrolls into a Medicare Advantage plan, when they call one of those TV commercials, right, whether they call the Joe Namath commercial, Jimmy J.J. Walker, Joe Theismann, whichever celebrity's reading off the teleprompter not knowing what they're reading, and they're handing them a blank check to do so, to deceive you, to lie to you, to paint a picture that you're going to get a plan with no copays, free dental, vision, hearing, it's all going to be free. It's complete baloney and malarkey. Medicare Advantage plans definitely have copays. The reason why they legally can get away with that is because there's certain things that they have no copays on, right? Like preventative care. You can probably get a physical on every single Medicare Advantage plan in the country with no copay. A lot of plans give you primary care doctor visits with no copay. But you're going to pay copays for 90% of everything you can have done on an Advantage plan. Specialists are typically going to have a copay with most plans. Emergency rooms, hospitalizations, you name it. You use it. The more you use it, the more out of pocket you're going to pay. It's not a Medicare supplement. But they paint the picture that it is on the TV commercial. So people pick up the phone, they call those TV commercials. So I wanted to paint a picture with that. What happens when you call is you are routed to a call center. And that call center that you're routed to, you're essentially linked up with an insurance agent that works for that call center. They're going to typically they're going to be taking calls from all 50 states most of the time. And they enter in your zip code and they're looking at the Medicare Advantage plans for the first time. They don't know your local hospital. They don't know your hospital systems. They don't know the geographical areas. They don't know a thing about your state. Not a thing. And they're putting in your zip code for the first time, looking at the plans for the first time, and trying to very quickly make a determination on what they're going to sell you. So what you find when people do this is they get put on plans that don't have prescription drug coverage, and they're told that they do have prescription drug coverage. They get put on plans that have probably the weakest network in that area, and they lose 90% of their network like that. Snapping your fingers, just like that. So when people call Joe Namath, you get screwed. You do. And this is why. Medicare Advantage plans are tremendously different all across the nation, all across the country. Even in some states, the plans could be different in one side of the state than they will be on the other. So the reason why that matters is because when you're dealing with somebody that's taking calls from all 50 states, hundreds and hundreds of markets, thousands of Medicare Advantage plans they're dealing with on a day-to-day basis, do you think they're going to memorize them all? Do you think they're going to ever seen your plan before? They're not going to know 10% about the plans in your market that somebody that lives there would. Right? Or maybe someone that's worked in that market tremendously amount. My office probably knows more about any of those markets than any of them do. And so this is what you get. So you get put on plans that have little tiny networks. They don't cover your doctors. They don't cover your prescriptions. They don't cover this. They don't cover that. So the reason why this matters is because that gives Medicare Advantage plans a bad name. Any person that's ever enrolled into a Medicare Advantage plan that's had a bad experience, one of three situations happened. I promise you, you can push everybody that's had a bad experience with Medicare Advantage into one of these three camps. One, their doctors weren't checked. Now, a side note to that, it is possible that Medicare Advantage plans can drop your doctor out of the network in the middle of the year and you're stuck on it. That is true. Does it happen often? No. It doesn't happen often. I don't care what anybody says. I've probably seen it happen 2, maybe 3 times that I can recall. It's not a regular occurrence like it's happening around the clock, but it can happen, sure. So I'll give that as the exception, but I'm going to say 99% of people that complain about Medicare Advantage plans, that's not what happened. They were enrolled into a plan and their doctors weren't checked. It's vital that when you enroll into a Medicare Advantage plan that your specific doctor is checked, looked up by name, and confirmed that they're in the network. So the person gets on the plan, doesn't cover their doctors, And they're like, well, Medicare Advantage sucks. No. You're enrolled into the wrong plan for you. There might have been 7 other plans in your market that covered your doctor and you would have loved it. And again, it's not that person's fault. They don't know what they don't know. But that's situation number 1. Situation number 2, their prescription drugs were not checked. Every single Medicare Advantage plan is going to have their own unique formulary. And this reigns true if you go Medicare Supplement also. Because if you go Medicare Supplement, you have to pick up what's known as a Medicare Part D prescription drug plan, an individual drug plan. And the reason why that matters is because the formularies are going to vary across all the different plans, right? Some plans might cover your certain prescription, others might not. Some might cover it better than others. Some might place it into lower tiers, and others might place it in higher tiers, which affect your costs in the bottom line. Some might have, take your pick, higher prescription drug deductibles, whatever the case might be. So that's no different no matter which way you go, folks. Medicare Supplement or Medicare Advantage plans. They kind of have the same system on the Part D drug coverage. It's built the same way. It has the same structure in terms of coverage. So you get that on both sides of the aisle. But maybe their prescription drugs weren't checked. And they're enrolled into a plan, and all of a sudden, they're pushed into a plan that doesn't cover their prescriptions. And they blame Medicare Advantage. Not fair, but that's what they do. Number 3, they're enrolled into a Medicare Advantage plan that does not have great medical coverage just due to the fact that maybe it has a greater dental benefit. So crappy medical, maybe decent dental. I don't believe that's a good trade, first of all. Buy an individual dental plan if that's such a big problem for you. Pay $20, $30 a month for it. But make sure your Advantage plan has good medical. Low copays if you can help it. A low max out of pocket if you can help it. So if you might have seen somebody that got put on a plan that had a $7,000, maybe $7,550 maximum out of pocket. They get cancer, kidney dialysis. One thing I would say about Medicare Advantage plans is if you end up needing chemotherapy or kidney dialysis, most Medicare Advantage plans will work as an 80-20 split. So you pay 80%, they pay 20%, and you pay 20% up to your Medicare Advantage plan's maximum out of pocket. So if you have a very high max out of pocket, that can sting quite a bit. But it wouldn't sting as bad as a $3,000 max out of pocket. So I think that's why you should pay attention to your max out of pocket. Certain people that, promote plans that have hugely high max out of pockets will say, well, only 2% of people nationwide hit their max out of pocket. But you could be in that 2%. It's not impossible. What a dumb argument. If there's a plan available that is equitable in other areas, and maybe there's not. At that point, maybe you should look at Medicare Supplement. But if there's plans available that give you equitable benefits in other areas and other criterias, and you go with a plan with maybe the double, if not more, max out of pocket, well, yeah, that could be something that stings. And they're like, oh, Medicare Advantage sucks. No, folks. Medicare Advantage has its place. Medicare Advantage can be a great thing for you. And it's not for everybody. I've said it before and I'll say it again. Medicare Advantage plans and Medicare Supplement plans, one is not better than the other. They are just different. They're like apples and oranges. They both have their positives and negatives, no matter what anyone might tell you. And it just kind of depends what your needs are, what your specific situation is, and do you like the taste of apples or oranges better? There's no right or wrong answer. You might like apples better. I might like oranges better. I just might like how it tastes. Does that make me wrong? Does that make you right or wrong? No. And certain people like to save their premium and take their chances with their health. That's okay. And truth be told, for all the demonization of Medicare Advantage plans, a $3,000 or $4,000 max out of pocket in a lot of places, it's not going to destroy a lot of people. Right? You could have $200,000 in medical bills on a Medicare Advantage plan, and if you hit your max out of pocket, as long as you stay in the network, of course, you're done. They pay everything after that. So that is why if you know somebody that has had a bad experience with Medicare Advantage and they say it's no good, I guarantee you it's one of those situations. Just understand the truth behind it. See the forest through the trees. Medicare Advantage is not bad. But also see the forest through the trees that the TV commercials are trying to convince you the opposite. Medicare Advantage is the best thing ever, and it's the solution to every problem. That's not true either. Understand that both sides, both ways you can go, have their good and bad to them. Both sides have their positives and negatives. And it's going to depend on what you need and what you prefer specifically on which way you should go. Understand both sides. You're going to have more power to you, and you'll make a more informed decision. Anyway, folks, I hope you enjoyed this episode. If you did, please do me a favor. Leave us a 5-star review if you're listening to us on a platform that allows you to do so. If you're watching on YouTube, drop a like on the video. It helps so much with the YouTube algorithm. It helps us find more people just like you who need to hear our message. So I'd greatly appreciate it. And if you need help with your Medicare this open enrollment period, my office is licensed in about 43 states all over the country. Our office number is 801-255-5340, 801-255-5340. We'd love to help you. And even if we can't help you, we actually work with agents all over the country, so you might be able to work with somebody who partners or works with my organization in person in your state if you prefer that. And if we don't have anybody there, I probably know somebody there. So calling our office has no bad things to it. I mean, we typically know someone in every single state that can help you if we can't do it ourselves, but a lot of places we can. So I would love to be able to talk with you and help you this open enrollment period. No cost, no obligation, of course. And if you're in the best spot possible, we'll be sure to tell you that. Anyway, folks, thanks so much for watching. Enjoy this. We're going to be bringing you an episode every single Monday. Can't wait for next week. Episode 258 out. And happy Medicaring.